Let's be honest for a second. You've probably already Googled hip pain exercises a dozen times and gotten a wall of stock photos and vague advice like stretch more or strengthen your core. Thanks, very helpful. What you actually want is something you can do, starting today, that doesn't require a gym membership, a foam roller collection, or a physical therapy degree. So here's the deal. Over the next 7 days, you're going to do one new movement each day. Just one. 5 to 10 minutes, tops. By the end of the week, you'll have a small toolkit of exercises that target the usual suspects behind nagging hip pain. Tight hip flexors from sitting all day, weak glutes that aren't doing their job, and stiff joints that just need to remember how to move through their full range. All right, let's get into it. Day 1. The couch stretch. This one has a silly name and a serious effect. If you sit for most of the day, your hip flexors, the muscles at the front of your hip that lift your leg, get short and tight. They basically forget how to lengthen. And when they're tight, they pull on your pelvis all day long, which can throw off everything downstream, including your lower back and hips. Here's how to do it. Kneel in front of a couch or a sturdy chair and prop your back foot up on the seat cushion so your knee is bent behind you. Your front foot is flat on the floor in front of you, knee bent at roughly 90 degrees. Now, slowly rise up so your torso is upright and gently squeeze the glute on the back leg. You should feel a deep stretch running down the front of that hip and thigh. Hold it for 30 to 45 seconds, breathing normally. Don't hold your breath. People do that without realizing it. Then switch sides. If it's too intense at first, that's fine. Just don't go as deep. You're not trying to win anything here. Do this once on each side today. Notice how it feels. Some people feel an immediate looseness. Others feel almost nothing the first time, and that's normal too. Tissue changes take repetition, not miracles. Day 2. Glute bridges. Yesterday was about lengthening. Today we're building strength, because tight hip flexors are often just half the story. The other half is usually a set of glutes that have gone quiet. When your glutes aren't firing properly, other muscles start compensating, and that compensation is often where the pain creeps in. Lie on your back, knees bent, feet flat on the floor about hip width apart, heels a few inches from your fingertips when your arms are down at your sides. Press through your heels and lift your hips toward the ceiling, squeezing your glutes hard at the top. Your body should form a straight line from your shoulders to your knees. Don't overarch your lower back to get there. Lower back down slowly. Do 12 to 15 reps. If that feels too easy, pause and squeeze for 2 full seconds at the top of each rep. It changes the exercise completely. A common mistake here is letting the lower back do all the work instead of the glutes. If you're not sure you're doing it right, place your fingers on your glute muscles as you lift. You should feel them clench. If you feel mostly your lower back working, slow down and focus on squeezing your butt, not just lifting your hips. Day 3. Standing. Hip circles. Today's movement is less about stretching or strengthening a specific muscle and more about restoring range of motion to the joint itself. Hip joints are ball and socket joints, meant to move in circles, not just back and forth like a hinge. But most of our daily movement, walking, sitting, driving, only uses a narrow slice of that range. Over time, the joint sort of forgets the rest. Stand next to a wall or chair for balance if you need it. Lift one knee up toward your waist, then slowly rotate it outward, like you're tracing a big circle with your knee, out, back, down, and around. Do this slowly and with control, not fast and floppy. 10 circles in one direction, then 10 in the other, then switch legs. You might notice one direction feels smoother than the other, or one leg feels stiffer than the other. That's useful information, not a problem to panic about. Most of us are asymmetrical, and just noticing it is often the first step toward evening things out. Day 4. Clamshells. Back to strengthening today, but this time we're targeting the muscles on the side of your hip, specifically the glute medius, a smaller muscle that's easy to ignore but does a lot of quiet, important work stabilizing your pelvis when you walk, climb stairs, or stand on one leg. Lie on your side, knees bent to about a 90-degree angle, stacked on top of each other, feet together. Keeping your feet touching, lift your top knee up like a clamshell opening, without rotating your hips backward. Imagine a string running through both hips, keeping them stacked and facing forward the whole time. Lower slowly. Do 15 reps, then switch sides. If you want to make it harder later in the week, loop a resistance band around your thighs just above the knees. But for today, body weight is plenty. The goal is control, not intensity. A lot of people rock their whole body backward to get the knee up higher, which defeats the purpose. Smaller range with good control beats a bigger range with a wobbly hip. Day 5. The 90/90 stretch. This one looks a little awkward, but it's one of the best moves for hip mobility, and it hits both the front and back of the hip, depending on which direction you lean. Sit on the floor. Bend your front leg so your knee and ankle are both at roughly 90 degrees, shin angled across in front of you. Bend your back leg the same way, but angled behind you, also around 90 degrees. Your front knee should be pointing forward, your back knee pointing out to the side. Sit up tall, and you'll already feel a stretch in the outer hip of your front leg. To deepen it, hinge forward gently over your front shin. To target the back leg instead, rotate your torso toward your back knee and lean over it a bit. Hold each direction for 30 seconds, then switch which leg is in front and repeat. Move slowly, getting in and out of this one. It's a bit more involved than the earlier stretches, and there's no rush. Day 6. Standing hip abduction. By day 6, you've built some strength and mobility separately. Today's move asks your hip to stabilize while your leg moves away from your body. A pattern you use constantly without thinking about it, like when you step sideways to avoid a puddle or catch your balance on uneven ground. Stand tall, holding onto a wall or the back of a chair for balance. Keeping your legs straight and your toes pointing forward, resist the urge to turn your foot out. Lift one leg out to the side, just a comfortable distance, then lower it back down with control. Don't let your torso lean over to compensate. Try to keep your hips level the whole time, like you're balancing a book on your head, except the book is your pelvis. Do 12 to 15 reps per side. This is a small movement, and it should feel like your standing leg's hip is working hard to keep you steady, even though the moving leg is doing the visible work. Day 7. Full body flow. You've made it to day 7. Instead of one new isolated exercise, today's session strings together a few of the moves from the week into a short flow. The idea being that your hip doesn't operate as isolated muscles in real life, so it shouldn't in your final session either. Start with the couch stretch from day 1, 30 seconds each side. Move into 12 glute bridges. Then do 10 hip circles each direction, each leg. Finish with 15 clamshells per side. Notice as you move through it whether anything feels different from day 1. Maybe the couch stretch doesn't feel as intense. Maybe your glutes fire a little more naturally during the bridges. Maybe the hip circles feel smoother. These small differences are the actual signal that something is shifting. Not a dramatic before and after, but small, real change. What happens after day 7? Here's the honest truth. 7 days won't permanently fix years of sitting, tight tissue, and weak glutes. But it's often enough to notice a real, tangible difference. Less stiffness getting out of bed, an easier time climbing stairs, less of that dull ache after a long day sitting at a desk. Tissue and movement patterns respond to repetition, and a week is a solid first dose. If you felt better, keep going. Repeat the cycle, or pick your 2 or 3 favorite moves and do them most days. Consistency matters far more than variety once you've found what helps. And if your pain didn't budge or got worse, that's meaningful information too. It's a nudge to get it looked at by someone who can actually assess your specific hip, rather than guessing from general advice on the internet. Even well-meaning advice like this: pain that doesn't respond to gentle movement and basic strengthening is often trying to tell you something more specific. Either way, you spent 7 days paying attention to a part of your body that probably doesn't get much intentional attention. That alone is worth something.